He's a nice man. Warm hands.
Mysterious rug burns, getting all tongue-tied, and what in the little blue pill happened here? Today, we're breaking down and reacting to all of these shocking medical scenes and mind-bending injuries from one of my faves, House M.D. All right, let's dive right in.
You're not pregnant.
Well, I told you that. There's got to be some other reason I'm still spotting.
Sure.
Oh, so interesting. Doing the ultrasound, in the way that it looks like it's set up, this is a trans-abdominal ultrasound because they're wiping off the ultrasound gel that's on the abdomen.
You were pregnant.
I haven't even been on a date.
Right. Since it's physically impossible to have sex without someone buying you dinner.
I haven't had sex since I split up with my husband. That was almost a year ago.
Fine. Have it your way.
That you were pregnant, meaning that maybe that the blood test for the HCG was a little bit elevated, but that she hasn't had relations to make her pregnant, so it doesn't make sense.
It could be leukemia.
Definitely possible. The more likely diagnosis is hickey.
Well, it can't be a hickey.
The hickey is a mark that's made when you're kissing somebody and you have suction when you're kissing someone, and it causes a breakdown of the capillaries underneath the skin or in the skin and causes a petechial hemorrhage.
These were your brain waves at 2:45 a.m. Here it comes. There's an abrupt jump from slow wave sleep. This indicates partial sleep arousal. Most common type is somnambulism, sleepwalking.
That would explain why I'm so tired when I wake up.
Yes, and also why you were pregnant.
The patient's not lying, trying to tell the truth, but the patient doesn't know what's actually happening. That is so interesting. And a lot of times people do lie to doctors and medical staff. Most of the time, due to either embarrassment or they're trying to get something or trying to lead us down a path of what they think their diagnosis is.
He's got a temperature of 103.
And why do we care?
Because we're human beings. That's what we do.
Temperature 103, anywhere between like 39, 40 degrees Celsius, just for everybody out there.
You asked him what book he's currently reading.
I asked him anything I could think of. Favorite color? Whoa. Favorite dessert topping? Trust me, you never know what fact may prove the key to saving your life.
Whip cream.
It's angioedema. So angioedema is basically swelling of the face, but a lot of times related to the lips and the tongue. And we get really worried when somebody has this type of swelling because it can occlude the airway.
This is either a toxin, an infection, or an allergic reaction. I assume you gave him epi, so that rules out allergies.
So they gave him epinephrine. So when somebody comes into the emergency department when their tongue starts swelling, we treat it immediately like it's an allergic reaction. So you're giving potentially Benadryl, steroids, epinephrine, and sometimes we'll even use what's called racemic epi, which is basically inhaled epinephrine to see if it's an allergic reaction.
We'd bet money something will go wrong. Let's rotate him back.
Got to the point where it's swelling so much that now he's putting some betadine on his neck, which is cleaning the skin to kill all the different micropathogens, and they're about to cut open the neck.
Hi, I'm having vaginal pain.
It's so awkward, I have to say. Like, this individual is in the stirrups, in a lithotomy position, and facing the door. Oh my goodness.
Pleasure to meet you.
My OBGYN died recently. He's a nice man. Warm hands.
I will tell you, I don't know why, but at work, I have cold hands often running around, but I always pre-warn patients when I do the exam, hey, I'm sorry if my hands are cold.
Not anymore. So, does it hurt when you tinkle?
Yeah, it's when it's worst.
You have some vaginal tearing. No sign of bruising, no indication of trauma, forced entry.
So that light source is just connected to the plastic speculum. There's lubrication that's put on the end of it, and typically what you would end up doing, you don't go directly in, so you know it's not actually doing the exam. You actually turn that sideways. That way it is going in the opening to the vagina, not as abruptly if it was horizontal.
Ramona, you naughty girl. Either you've got yourself an 18-year-old boyfriend or an 80-year-old with some little blue pills.
So he's describing somebody having some sort of sexual relations with a little bit of tearing, so stretching or tearing, like little cracks within the skin, and bruising. So he's describing evidence of some sort of trauma or event. As we get older and in the elderly population, anatomy changes a little bit, and so you can get a little bit more dryness down in your groin. So there are medications that the doctor can prescribe for this.
There's nothing wrong with your eyes.
Well, then your gizmo's broken.
Isn't that the worst, the ophthalmoscope? But we're trying to look through the eye and actually looking at the back of the eye, looking at your optic nerve, all the blood vessels, and your macula. The other tests that we would do in the emergency department related to eyes would be eye pressure, as well as your normal eye exam, just to see how well you read the eye chart.
I'm seeing spots.
They didn't come to free clinics whining for doctor's notes.
Seeing spots can be multiple different things. Could be related to the eye itself, could be related to floaters, damage to the eye itself, damage to the retina, maybe not related to the eye, it could be related to the brain.
23-year-old just came into the ER, asked for you.
What's her cup size?
I don't think his cup size is relevant to his condition. He accidentally shot himself in the foot.
Oh. Seriously? I give you a choice between moving to Canada and shooting yourself in the foot, and you chose the bullet? Patch it up and send you right back.
Don't patch it up.
We do get people who accidentally shoot themselves. I've seen it more than a handful of times in trauma centers that I've worked at. Most of the time it's related to poorly controlling your weapon. But this, you shot the foot, you can hit the bone, and you get an x-ray, see what that looks like. You also have to look at the vascular aspect of it, and you'll typically have a trauma surgeon take a look.
You don't need a $400 handbag.
It's kind of hard to check your throat when you're flapping your gums around.
Hi.
So doing a posterior pharynx exam with a tongue depressor and a pen light is hard to do just because somebody will fight against it like he is here. Most of the time I get somebody to relax as best we can and just breathe.
I've got no appetite. I'm aching all over. I'm weak.
Is that hard?
Yeah.
Does his voice always have that unattractive nasal tone?
He's pushing on the forehead to see if that hurts. You have frontal sinuses. He's congested. Let's see what he comes up with.
Fever, aches, weakness, loss of appetite. Been having any anal sex with IV drug users lately?
Of course not. I'm married.
You think she might have been having
No.
It's probably a rhinovirus.
What's that?
Viruses causing URI type symptoms, causing congestion, and can cause sinusitis. It's actually the more common reason why you'd have sinusitis. Now, sometimes if you have a viral sinusitis that stays for a long time and a lot of congestion up there, sometimes it doesn't allow the normal flow in and out of your normal secretions, thus increasing the risk of then getting a bacterial infection on top of it.
Cold. Take this 4 times a day. Stay off airplanes, flying cesspools.
When people have URIs, you can look in their nose and they have the turbinates, which are just like pink tissues within the nose. And sometimes if they're bluish or really bright red, it also helps as an inflammatory reaction. Is it more chronic related to allergies? I like Dr. House. Do you guys have any other scenes, clips you want me to check out? Let me know in the comments. And if you guys enjoyed this, definitely check out this playlist right here. Binge watch everything. And please make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.